As the normal imaging sequences take quite some time, only a limited number of patients can be examined. It is also often very difficult for the patient to lie still for a long time, and image quality decreases with movement. In addition, there is always some unavoidable motion, like respiration and heartbeat. To help with these problems, fast pulse sequences were developed which take less time. Most of these have strange names such as flash, fast, low, angle, shot, or grass, gradient, recalled, acquisition, at steady, state. These sequences are very important nowadays in daily practice. Here is a rough outline. As you may already have noticed, the TR is the most time-consuming parameter of an imaging sequence. It makes sense to shorten TR if we want to make imaging faster. And this is done in the fast imaging sequences. But with the decreasing TR, there are some problems. Firstly, with a spin echo sequence, we used a 180-degree pulse to refocus the dephasing spins. Unfortunately, we cannot use a 180-degree pulse for this purpose when we do imaging with a very short TR. It requires some time to deliver a 180-degree pulse, and with a very short TR, there will not be enough time between the 90-degree pulses. Secondly, with decreasing TR, longitudinal magnetization will have recovered less and less between pulses, as we have already seen in this figure. So there is only very little longitudinal magnetization to be tilted by the next pulse, yielding very little signal. These problems are solved as follows. We use a different way to refocus the dephasing spins. Instead of a 180-degree pulse, we apply a magnetic field gradient. This means that an uneven magnetic field, a gradient field, is added, superimposed on the existing magnetic field. The magnetic field gradient is switched on for a short time. This results in even larger magnetic field inhomogeneities in the examined slice. The magnetic field inhomogeneities that already exist at that time are due to inhomogeneities of the external magnetic field and the internal magnetic field inhomogeneities inside of the tissues, which we talked about earlier. If you can't remember this, go back to section 12 to recap. Due to these larger magnetic field inhomogeneities, transversal magnetization, and thus the signal, disappears faster. Protons dephase faster. Then the magnetic gradient is switched off, and after a short time turned back on with the same strength, but in the opposite direction. The faster-moving protons now become the ones that move more slowly, and vice versa, similar to what happens after a 180-degree pulse. This results in some rephasing, and thus the signal increases again to a certain maximum, which is called a gradient echo. After this echo, the signal decreases again. What to do about the second problem? The small amount of longitudinal magnetization with a short TR. The 90-degree pulse, for example in a spin echo sequence, abolishes longitudinal magnetization. Longitudinal magnetization, however, starts to recover immediately after the 90-degree pulse, depending on the T1 of the tissue examined. The trick with the fast imaging sequences is not to use a 90-degree pulse, but pulses that cause smaller flip angles, mostly in the range between 10 and 35 degrees. With these flip angles, smaller than 90 degrees, longitudinal magnetization is not totally abolished. Instead, there is always a substantial amount of longitudinal magnetization left, which can be tilted by the next pulse. This gives a reasonable signal even if the next pulse comes in after a very short TR. As we have heard, a 180-degree pulse normally neutralizes the effects of external magnetic field inhomogeneities. The decay of transversal magnetization is then due to so-called T2 effects. When we do not use such a 180-degree pulse, the protons experience larger magnetic field inhomogeneities and get out of phase faster. Signal intensity decays faster, and in this case is due to so-called T2 star effects. Besides these T2 star effects, other factors, for example the flip angle, influence signal intensity in the fast imaging sequences, which are also called gradient echo sequences for obvious reasons. Here are some guidelines about gradient echo imaging. Larger flip angles produce more T1 weighting. Longer TEs produce more T2 star weighting. With fast scans, intense signals often come out of the vessels. We save imaging time because, with small flip angles, we only need an RF pulse of short duration. We do not use a 180-degree refocusing pulse since it takes time to generate and take effect. We do not have to wait long TRs for enough longitudinal magnetization to reappear. As with small flip angles, there is always a reasonable amount of longitudinal magnetization left after the initial pulse. With these fast scans, it is possible to do imaging in a second or even less.